Well, yeah, thanks for joining us today, Bishan. You've been an emergency physician for some years now, and you've had an interest in wellbeing. And certainly in this last COVID year, there's been a lot of talk about wellbeing on the media amongst different professions. So I'm wondering, from your perspective as an emergency doctor, what is the meaning of wellbeing for you, both professionally and personally, and especially in the context of COVID?
Well, thank you. That's a very good question. What is the meaning of well-being for me personally, and especially in the context of COVID? So I think to preface the answer to that is that there are probably no good answers, but only good questions. And I think it's an ongoing journey. What does well-being mean? When I first started on this journey of well-being, I kind of thought, to me at that time, well-being is just sort of being happy. But I have kind of had to revise that because I've become more realistic. And I think a lot of it is to do with my own personal journey, my own kind of awareness of what I value in life. Can you hear me okay?
I can hear you really well. Yeah.
Okay. And I think that there is a lot of stuff that I have reread along the way. There's concepts such as the happiness trap. I think a lot of people understand that our jobs are very difficult if you're going to do maybe any kind of caregiver, you're going to be a healthcare worker, but meaningful. And I think well-being is simply being well, and being well in doing something that is difficult but meaningful. And I always bring it back to a simple principle, is to remember the why I'm doing what I'm doing. And I have to ask myself that regularly. I try and do it daily when I can. And even today, so you caught me on an average day in emergency medicine, which is a sort of unpredictable day, but we are faced with constant challenges and unpredictable kind of events. And in actual fact, it's not the fact that it's unpredictable. There is a sense of challenge and chaos to what one has to encounter. It's more about how you handle that. And to me, well-being is about developing strategies to handle the challenging situations ahead of you, and also to actually work well with others to achieve the same objective. And that really ties in with COVID, because I think with COVID, it's been interesting for me, being someone who champions that path of trying to create well-being for myself and others, is that COVID has suddenly brought to the limelight the importance of this. It's not lip service, it's actually core business. So with COVID, what is really happening is it's impacting on society in general, but also healthcare settings, particularly frontline workers like emergency departments, emergency physicians and nurses and the staff. And it's brought to the front line the uncertainty of the future in terms of months, in terms of ability to do your work, or risk to yourself in getting the virus, or the extra precautions we have to take to prevent spread. It's uncertainty even by the hour. Now, for us who are used to that, it's actually more that a lot of people who aren't used to that are now sort of entering into our world. And what we realize in our world, having strategies to be well in that journey, to be well in the process of doing something that's difficult, to be about the journey, that is actually now paramount. And perhaps that's why we're seeing more interviews like this in preparation to help people who probably haven't spent as much time thinking and practicing it, but also as a response to the downside of what happens if we don't. If we don't focus on well-being, what happens is we get sick, we get unwell, systems break down.
So, Bishan, thanks for emphasising the importance of considering well-being. And as you're probably aware today, we're running this interview for our new cohort of interns who are relatively new to considering self-care and well-being at the beginning of their own professional journey. Are you able to share a self-care plan or tips, if you will, that have helped you support your own well-being?
Yeah, sure. Look, I can give you some tips, but before we do that, I'd like to do one more thing. One of the things I like to do, and which I will do on the day, is to engage our audience a little bit. And one of the things, the tips, before I give you the tips for well-being, I know that it is an important topic for all of us in different ways. And I know that you yourself, Anna, have had a bit of a journey into this well-being. And I think in our conversation before, you did mention your interest and your research in the past in doing that, just for the background. So I know who I'm talking to, but you did get involved in some research, a master's or something on a topic. What was that topic? Can I ask you?
So I guess more than 2 decades ago, we ran something called a Maslach burnout inventory for just over 200 GPs in this district.
Mm-hmm.
And it confirmed what literature tells us, that there is an increased risk of burnout amongst medical practitioners. I think that the aspect that was research which was particularly relevant for GPs was that their sense of depersonalisation increased with increased time pressures. So it was really apparent to me that managing time pressures should be part of self-care in the context of well-being. And I think more recently I attended a global conference where there was a speaker from North America who had run some very effective programs to improve well-being in a North American hospital. And what they showed to be most effective is where term supervisors and senior consultants took part in well-being strategies, including mindfulness, that it was more likely that junior medical staff would have better outcomes. So it also highlighted for me that well-being within an organisation is not just about tackling what an individual's doing, but what teams are doing to support their well-being.
Wonderful. Look, thanks for sharing that with me. And I think it's always easier to talk in context. And I think you brought in there, that's wonderful work, by the way. And I think it's as valid 2 decades on as it was perhaps the time you did it. And this is why I think this is fundamental educational work and practice. And I think tips for well-being was the question. And to put it in that context, I like to think of it in a number of ways. There's so many different things. I can give you a bunch of tips, but I think principles, self-care first. So it's prioritizing self-care. And then perhaps another principle is to have some form of debrief, okay? That's to deal with the trauma, the vicarious trauma that's often encountered in the healthcare setting, particularly if you're frontline and if you're emergency worker, okay? And then a sort of proactive community strategy. So basically some socializational element, okay? And then perhaps a fourth thing is, professional support. And that could be reactive or proactive. So what I'm talking about is things like counseling, psychologists, GPs, but proactive could be coaching and getting ahead of the curve and actually understanding that we are in a difficult, arena. And I think the last one, maybe the fifth thing, is an awareness. And I think by just having this interview and talking about well-being, we're increasing awareness. But I think the first thing I said was self-care, okay? So what does that involve? Well, for me, it's very individual to talk about for others, but it's also very simple. It is actually prioritizing you being okay, and only you will know that. So it's actually a difficult thing for a lot of people in medicine because they haven't grown up with that being modeled. The systems do not allow you to easily by default look after yourself first. We are carers. We are people in a caring profession who will often be pressed to come help others in need. One of the privileges of this job is that we are helping vulnerable people. So there is a sense of, well, why should I look after myself when I am being entrusted in the care of people who are far more vulnerable? In my job, every single day I've got maybe 12 bed spaces in the acute area of people needing pain relief, needing some care, needing someone to talk to quickly. We've got a category system, and it outstrips the ability to supply whatever that is being asked of. So then we have to do something where we do the best we can, and there is an element of something called moral injury from that. It's moral injuries when you're not able to deliver what you ideally want to deliver. And often you will compromise that self-care, going to the toilet, taking breaks, having a cup of tea, and the worst of all, taking a deep breath. Now, it sounds pretty woo-woo, but that is exactly what breath meditation is. And so what I'd like to do, I might have mentioned this in our informal chats, but I've been fortunate to be exposed to meditation a lot during my sort of adolescence, throughout my upbringing a little bit. And I haven't been a great practicer until maybe in my 30s. I'm in my 40s now. And I've done 2 long retreats of meditation, like 10 days or whatever, but you don't need to do that stuff. What I realized is that just having a regular practice, actually my current practice is 2 minutes. I do 2 minutes of sitting meditation. I try to every day, and you don't have to be rigid about this, but I have an awareness that whenever things get a little bit too much, I will stop and I will go inward, which is I use the breath to come into my heart, my lung space, and I just pause for a moment and I exhale. And that is what allows me to keep a calm within the storm. As perhaps, I worked a shift yesterday in an emergency department. There was a lot of tensions, as is often the case. And in amongst the chaos, you have that space between stimulus and response. That's a Viktor Frankl quote. Another thing I recommend is read widely outside of medicine to learn how to be better within medicine. But between the stimulus and response, there is a space. And that space is where we can choose how we respond, okay? And I think self-care, how we do that is we just give ourselves that moment to breathe first. And I think meditation is a beautiful practice because even if you do it for a short period of time, it's been akin to the greatest, the most concentrated form of self-compassion that we know, because we're giving ourselves time in a system where we have limited time. So I think that cannot be stated enough. You don't have to do meditation, but mindfulness is probably the way. That's just having an awareness that we have this busy mind, not necessarily our fault. We've got lots of input into the mind space, the consciousness space, but we have the ability to see that. And also we have a body that we have to look after. And again, that first principle, self-care first. We can only effectively or maximally effectively look after others if we look after ourselves. So it sounds very trite and it sounds cliche because we've heard these things. But the key is, how do we practice this? So that goes on to the other things I suggested. So how do we practice this? So if I've done a busy shift, or if you're a JMO, this is pitched towards the interns, you may have a busy on-call shift and you may go away from it and you may feel like you've done maybe 10 things right and 50 things wrong, because that's how we're educated, right and wrong. But in actual fact, you've made effort towards better care and better staff, interactions, probably 100% of the time, as best you could. But, your outcomes may not be the good. Whatever you intended to happen didn't happen. You made a few mistakes. You didn't get the cannulas or whatever. And you might really feel quite deflated at the end of that, because we're in, the medical school teaching environments, high pressured, high scores necessary. Perfectionism is probably by default entrained in us, and high standards at least. And the the pathological side of that is perfectionism, which is no good for anyone really. High standards, for fair enough, but to be able to fail with grace is also an important thing, and to learn, you know, and with safety. And that's one thing both you and I know, Anna, from being in this system for a long time. The systems are a lot safer than they used to be. But this has been my observation. The safety for our patients and ourselves is a lot better, but the stress levels is a lot worse. That's the way I perceived it, because we have more monitoring systems, and a lot of the juniors don't realize this. Don't you think? They get told, juniors get told, oh, well, you know, I don't know what you're worried about. We used to work 10 times harder and blah, blah, blah. Well, we used to work longer, maybe, you know, I worked many longer hours before, but we had more free reign. We had more autonomy. When you had more autonomy, you had less people, less systems controlling, you know, how you're perceived, watching over you. You had less observational stress. So I think we have to be honest that we are putting that on to the next gen, and we're doing it in the name of patient care, but we're not doing it in the name of self-care. Not intentionally, but that's what's happening. It's the self-care is something that we have to pump up a little bit, and we have to find to do it in ways which are collaborative and respectful, that we're in a system and a team. We're in a team where everyone has got competing pressures. So, I mean, I guess by doing that time where you actually either on shift, take a deep breath, have a moment's pause, reset, reframe. Then after a stressful test, what I was leading into was debrief. So debrief. So that's something I learned from my kind of experience with simulation education. Very important. So I did research in simulation education. I'm very passionate about it, but I'm passionate more about the principles. And the principles are, when you look at something with an intention to learn, and I suggest that we look at every day that we go to work in medicine, no matter what stage you're at, if you're a consultant, specialist, or you're a medical student, we all go there and we hope to learn every day to improve our practice. And that's one of the things beautiful about medicine. We're always learning. And I think what we can do is we can then take that time to reflect upon what happened and then reframe it. Because our default is often to be really hard on ourselves. And I actually learned this, my dad's a physician. I actually learned this from a period where I was experiencing burnout, you know, looking back. And later on, I was aware of it. And I was, you know, as a sort of moderate, well, not senior, but yeah, medium seniority registrar, advanced training in emergency medicine. And I was just feeling so deflated and defeated, working in a really pressured system where you could never do enough, certainly by my own standards. And that's where I realized the problem was. I was never able to hit the marks that I set for myself. It was good that I set high marks. I wanted to be able to see patients. I wanted to have a good time, laugh and joke with people, but I just couldn't achieve it. And I tried, I'd go in there, and then at the end of the day, deflated. But what you can do is you reframe it. You had a question.
So how did, I realize this might be touching on some personal issues, but when you went through that difficult time, how did you turn that around? And who were people who what sort of staff members, or what do the staff members look like that helped you to turn that around?
Very good question. And it's no problem talking about personal issues. In fact, part of this interview is to put a personal face to what is a global and a universal problem, right? How do we manage our well-being? And for me, with those pressures of having high standards, which is very common amongst our community of medics, I think it is about seeking those staff members who can help you. What we tend to do sometimes, or what I have done in the past, is seek out those staff members who can perhaps be very knowledgeable, but not all of the ones who are knowledgeable are also the ones who could be supportive, right? And also, knowledge is a perception. What you realize is there is a predilection towards sort of people who are kind of pretty knowledgeable and looks like they got it all together. But in reality, everyone, sorry, I just dropped my card. Everyone is in healthcare is to some degree holding it together, but showing a brave face, particularly in pressured environments. And with the fact that every patient's uncertain. And so what I did was I found myself mentors. And what I mean by that is not, will you be my mentor? I want to be your mentee. Let's have a mentorship relationship, which is something I'm trying to facilitate at the moment. But I'm also talking about low-level mentorship, where the fact of the matter is, there's someone I get on well with. There is a relationship here, which is supportive to both parties. They seem to be enjoying being around me. God knows why, but, I'm the junior person who doesn't know anything, but they seem to be, enthusiastic and talking to me and hearing about all my challenges and saying, don't worry, that's fine. I don't know why they're saying that, because to me, it's not fine. But after spending time with someone, like I do remember, for example, I did have, when I was first an emergency registrar, I changed from a career in surgery to emergency. And, I had my first real trauma, which I was involved in team leading in the middle of the night, the end of, it's about 6 o'clock in the morning. So really tired, end of a set of nights. And it was challenging. It was a cyclist in a 35-year-old versus a truck. I mean, the poor man was probably not going to have much hope of coming out of this in a good way. But back then I went in gung-ho, and, I did the best that I could with knowledge. I thought I followed my ATLS and, been on these courses, but things didn't go that well. We had a some of it was predictably bad, some was unpredictably bad. We had a esophageal intubation, so sort of missed intubation initially, so that caused trouble. There was multiple injuries. There was basically life-threatening exsanguination, and the patient died, and it was difficult. To wonder, could I have done something better? But this is where I knew at an intuitive level, I already was doing the right things for my well-being. I did 2 things after that shift. Straight away, the consultants were coming in the morning, and I went to one, and intuitively I went to the one who I knew would have that extra compassion, a kind emergency physician. I said, look, can I talk to you? And he said, yeah, sure. Because they're busy. They've got to deal with all the things that are going on in a new department. He said, did I, we had the thing, this is what happened, our team led, but I'm wondering if I should have put like the ICU guy on airway, because, there was a bit of the anesthetic person wanted to do this, and maybe I could have controlled things better. And he said, do you think they died because I did something wrong? And that takes a lot of vulnerability to ask that, but that's also about the trust of the senior. And that person said, look, I don't think so. These things are always difficult. I wouldn't beat yourself up about this. If you look at it from the outset, so this person was someone who could see things clearly with emotion taken out a little bit, and said, look, this was someone who had significant traumatic injuries from a high mechanism. The chances of survival was always going to be low. And I think you should go and have a sleep, And then I went and talked to my buddy as well. And, we had coffee afterwards. And that's something I do after night shifts. And I recommend the juniors to do it if they can, if they're able to have a bit of a coffee debrief with people after their last night shift. And my friend said, I told them what happened. And he goes, oh my God, Bish, did that happen? I'd feel awful if that happened to me. And you may get that, but there's someone, I said, here I was like, yeah, but he, I said, oh no, don't worry. But that was just a reflection of just how self-critical that particular person is, right? And I think, and it's very common in medicine, but I wasn't perturbed by that because I'd already spoken to senior. And also, you did need that support from a collegiate level. At least I knew that they knew what had happened to me, and they were supporting me. I mean, that person also, we met later in fellowship journey, and we actually studied together, and we're good buddies, and she's an emergency physician. And as well, and we may talk about this one day, and she probably won't remember that at all, but it's interesting because this is happening every day. And one thing I notice, Anna, is that the students of today and the interns of today, I notice there's a different culture to the interns of 20 years ago. And one of the things is, I feel there's less conversation about mistakes. I think there's higher pressure to get into medicine. Well, not maybe to get in, it was hard to get in back then too, but there's higher standard everywhere. And I just find that there just isn't as much camaraderie around. There's more competition to get on programs and things like that. Like when I started emergency medicine, I just had to call up the office and register. You know what I mean? And it was pretty easy. I paid $300 and then I was on, I was on a provisional training program, and then there was exams. But even now, it's much harder. And so I think, people are they're not so facilitated to be vulnerable. And it's that vulnerability that gives people a sense of being human. We are human doctors, not mechanical doctors.
I think that's such an important value that you're espousing, Bishan. And I do agree that there are a lot of contextual factors, particularly in hospitals, that work against that vulnerability. And we have seen in COVID that making yourself vulnerable is actually helpful. So sharing that it's hard to cope with the realities of COVID has been helpful for many staff across lots of disciplines. Yeah, so thanks for bringing that up. So I just have one more final question. You might have some other things you want to talk to, but
yeah,
I think, Phil, thank you for just sharing lots of good ideas and strategies and ways of being that you've integrated into being someone who is conscious of the value of well-being. And in the end, it is a value. We have to choose to value that. So I think you've covered a lot of great ideas. If we could put you into a sci-fi movie, Bish, and put you into a time capsule and you could go back to your intern year,
yeah.
What bit of wisdom would you share with yourself to support the transformation of your well-being from that early stage of your professional life?
Yeah, it's interesting. I guess something that's helped me, it's a long time with the intern year, but I do remember it well. I remember being a medical student well. And some of the principles that that always sort of tend to get me were things like imposter syndrome. And that is the feeling that, you know, maybe I haven't got as much as what it takes. And imposter syndrome is so prevalent, and it's everywhere. Like, even I'm someone who surfs, right? And you know, like, you can be out in the lineup and trying to catch a wave, and you're an imposter, especially where I am. There's a lot of pro surfers hanging around. And you think, well, you know, who am I to be
There
fifth
sure are.
wave? You know what I mean? You know?
Yeah.
And then after a while, you realize, well, you know, there's opportunities there, and why not me? Why don't I? So if you're an intern, why don't I have the ability to do this? Why not be curious and see how it happens? So I did practice that. And the other thing is to do a lot of talking to people and just sharing, but not with every single person. Have those people, those co-mentors, and then have the mentors. I think it's really valuable. It cannot be said enough, because I was someone who really walked a little bit out there. I was a class representative at medical school. I was always involved in helping other people. And it always amazed me who people who looked so confident and incompetent, they were competent, they were confident, but they still felt on the inside insecure like everyone. Just remember that everyone has got those challenges. And don't be afraid to seek help. There is no shame in struggle. And actually, I think it's really important. I mean, I think if you want tips, I read outside medicine a lot. And there's a book by Don Miguel Ruiz called The Four Agreements. And I love it. It's just a simple thing you can remember. I learned it when I was traveling, and I met someone in the Greek islands on the ferry cruise. And he heard of the Four Agreements. And one of them is be impeccable with your speech. So we should be kind to people. We should be respectful. We don't know what other people are going through. And I'm talking about staff members. I think the hardest things being intern is not dealing with patients. It's dealing with your colleagues, your other staff members, the other people in the team. And just remember, it is a team. And that's our strength. That's the saving grace. It's not the challenge. So be impeccable with your speech, how you treat people, respectful. Don't make assumptions. That is what I tell every day to my junior team members. Don't make assumptions. Document it. Check. You think that patients had pain relief? You may have charted it, but did you ask the nurse? How do you know they're on break? Do you ask the patient? Just check again. So don't make assumptions. And also don't make assumptions that someone else, came away from, a difficult scenario feeling fine about it. Maybe they were just at their wits' end. And just remember, in this age of well-being and mental health awareness, are you okay? Just want to check in. Are you okay? Then the other one is to don't make assumptions and don't take it personally. Number 3. Okay. Often things are happening for other reasons than what you realize. We are all ego beings and we tend to think everything is about us, myself included. And when you take a step away from all that, you think, oh, actually, maybe that's not about me. Maybe it's about something else that's going on. And when you do that, you don't take it personally. You can see what's actually happening. And the last is, and this is the most important, do your best. And that's enough. Just remember, you can never do more than your best. And I think if you just have whatever it is that works for you, have a set of principles that you go back to. And always remember, it is okay to fail, to make mistakes, and seek help. And you'll find that anything that you have done, and this is why you have a good mentor, they will reflect back to you that we've all done it before in a different way, but equal severity. Whatever you've done, whatever's happened, whether it's not passed an exam or whether you forgot to, tell something to a patient about some high level thing about a diagnosis, whatever has happened, we have been there, we've seen it, and the seniors have seen other people help people through it. So there is no need to struggle alone. You're never alone. And I think that's the beautiful thing about our system. We are in such a compassionate profession that has the capacity to be compassionate to each other. We practice it. So be kind to yourself. It's just as simple as that. Just remember that it's okay to be kind to yourself, but be respectful to others. I think that's the key distinction, where you may find that you'll have a few old school consultants who might be out there because they're just trying to look after what they have to look after. They're under pressure. Don't take it personally. But remember, if you can find the right time and go to the right people, you'll always get the support you need. And we all need support at time to time. We may be able to get it from ourselves, but if you get used to practicing. And the other thing about intern, which I tell a lot of people, is there is no time like being an intern to come clean with all sorts of stuff, because everyone knows it's difficult. So now's the time to say, hey, listen, I'm really sorry about this. I'm sorry to be a pain. No one is actually going to think, oh, you're such a pain, because they know, oh, they're only at the beginning of this journey. And there's plenty of high-level doctors who I've seen as interns now. I've been in the game long enough, who are doing incredible stuff. But when they were interns, they were just as green as you or I. Anna DeMarco, Bishan Rajapakse, we've all been green interns.
Exactly. Well, on that note, Bishan, I just wanted to thank you so much for sharing a lifetime full of experiences and great reflections on that important value of well-being. Thanks, Bishan. Thanks for joining us.
Thank you so much, Anna, for the opportunity, and thanks for being such a gracious host. Thank you.
Thank you.
See you next week. Excellent.